Hi Mama, I'm Katie. I'm very happy that you're joining for today's developmental video. I do these videos on a weekly basis where we talk about what is happening to our baby inside, how they're developing, as well as what is happening to mamas and how to help in pregnancy. This happens weekly, and then daily I have videos with different workouts, which I call the Great Pregnancy Challenge. So join me every day or every other day, combine 2 to 3 videos together to stay fit and healthy and prepare for pregnancy and birth and labor. So today we're going to talk about baby and mama. Week 30 is upon us. What is happening to baby? So our babies are now around 39 to 41 centimeters long. Quite long, right? And they weigh around 1.3 to 1.5 kilograms, which is quite a lot as well if you think about it, right? So they're already really quite large little human beings inside our bellies. And if you were to compare the baby in your belly to a fruit or vegetable, it would be a large cabbage or a butternut squash. So exciting times are upon us, week 30, around 10 more weeks to go. What is happening now to baby? Baby is going to be gaining around 200 grams of weight every single week now until birth. So they're going to get heavier and heavier, not necessarily that much bigger because 41 centimeters is already quite long. But they'll be gaining weight, and this weight is mostly fat that will keep them toasty and warm when they arrive into this world. So the brain development is happening really rapidly now. The folds are increasing, they're getting larger, so that the connections in the brain and between the nerve cells are strengthening as well. The eyes of the baby are opening and closing. The baby can react to light and knows when there is light versus there is darkness. So if you want to do a test and shine some light on your belly and see if baby will respond to that, they might. They can hear us since many weeks. They know our voices. Sudden sounds will startle them, but you can also try and see if using a soothing and calming voice and talking to a baby will calm them down. The lungs continue to develop, so this will happen still for the next coming weeks. But baby is already practicing the breathing motion itself, so the breathe in and breathe out, same as we do in our yoga practices, or at the end of a workout video. So the baby is breathing in the amniotic fluid and then breathing it out as well. And this is just helping to practice the motion when they finally arrive into this world. The digestion tract is still developing. The baby is swallowing the amniotic fluid, which is in your uterus. So they can already taste different things. So if you have a nice, rich diet and introduce multiple different flavors, baby will be already able to taste all these different flavors inside our bellies. They're moving a lot, they're stretching, they're kicking, although it is getting tight in there. So baby is having less and less space, and baby is growing. So you will feel the movement even more, and it will feel even stronger. The bones are hardening, so baby's bones are hardening. Apart from the bones in the skull, these will remain nice and soft until birth, until baby comes into this world, so that the skull can still move and the bones in the skull can move to be able to be birthed into this world. And baby is slowly curling into a fetal position now, As we said, there's less and less space for baby because baby continues to grow. So they're going to start now curling up into this fetal position. That's more or less the update for baby. Let's move on to us mamas. So the belly is growing, it's getting bigger and bigger. And the uterus is now sitting around 10 centimeters above the belly button. So you can see my belly button, which is sticking out here, above 10 centimeters more. This is the size of the uterus. So it is pushing upwards as well as downwards. So you will feel the pressure on your bladder more, which means you might be needing to go to the toilet more often. You'll feel the pushing and the pressure on your lungs and diaphragm, which means you'll probably be experiencing more shortness of breath than in the past, as well as indigestion problems and heartburn, because this affects that as well. There will be skin changes happening. If not yet, you'll probably start seeing them nowish. So the skin will be darkening, your nipples will be darkening. You might start seeing this linea negra, it's called, this line that goes across your belly this way. It will start to get a bit darker and darker. I just started to see this recently, so it will still probably get a bit darker. Your breasts might start producing colostrum, and they might start leaking. So if this happens, just be aware that it could happen. You can have some breastfeeding pads already with you. Put them in your bra to help with that, so you're not going to have wet stains around your breasts. You could be experiencing Braxton Hicks as well. So these are practice contractions that are happening in the belly. They shouldn't be painful. You'll just feel some tensing. So this is your body preparing for the birthing process. Do you have back pain? The center of gravity is shifting, the belly is growing, the baby is growing, so now 1.5 kilograms, and a medium average sized baby is around 3.5 kilograms. So there's still quite a lot of weight gain to be observed and to be felt, essentially. So that's why you might be experiencing some back pain as well, and pelvic pressure, since there's more weight kind of pushing down on the pelvis. What to do? Move with me. Join some of the workouts, join some of the stretching videos as well. Don't do only stretching, because we have this hormone called relaxin in our body, which relaxes all the joints in preparation for birth. But this means that it's easy to overstretch, and if you've never stretched in your life before, or you're not a stretchy person, I personally am not, then it is important to not now suddenly overstretch, as our body is not used to this. So strengthening the muscles is super, super, super important. So join me for those workout videos where we strengthen our bodies as well as stretch them. Do you have leg cramps at night? I did, until I started taking magnesium and a rather high dosage. So if you do get leg cramps, ask your doctor if it's fine to take magnesium or have a high dosage prescribed, and have that a few hours before bedtime, and that helps me for sure. Also, sleeping could be harder and harder. We are getting heavier. It is harder to change positions. You cannot lay on your back. You have to be preferably on the left side. I cannot sleep on my left side for the whole night, so I have to switch between sides. And even just the switching is getting a bit more difficult and harder to do. So getting a good night's rest is getting more difficult. What is really important is to use a pregnancy pillow to put that in between your legs, and have a good pillow that supports also your head and neck, so the body is nicely aligned, and also the belly is supported, so you don't feel any big pushes or pulls one way or another, which will result in discomfort and sleeping. I did make a video about pregnancy pillows. I will link that in the description box below, so have a look at that, how to use one correctly to get the best of the night's sleep. Right, and all of this essentially leads to us being more and more tired. We're getting heavier, it's harder to get a good night's rest. Everything is pushing and pulling and stretching. So you will feel more fatigue in these days. The third trimester is called the heavy trimester. So slow down, take it easy, drink a lot of water, support your body, keep training. Don't give up on that. That is super important. You are gaining more weight, so you should also be, training those muscles to support that weight. Not to mention that exercising during pregnancy will help with labor itself as well as postpartum recovery. When it comes to our emotional and mental well-being, because of all these hormones going through our body, and because there are only around 8, 10, 12 weeks left of pregnancy, you might be feeling emotional swings, some happiness, anxiety as well. If it's too much for you to handle, reach out to get some support from family, friends, and a doctor if needed. But emotional roller coasters are part of being pregnant, just so you know. Then, because there are only 8, 10, 12 more weeks left, something called the nesting instinct might kick in, which means you will be preparing your house for baby's arrival. So you might be cleaning more than usual. You might be stressing about the cleanliness. You might be preparing the baby's room or your room to adapt it to when baby also arrives. So that's a very exciting part of this trimester. You might also be experiencing dreams about labor and giving birth. So all of this is absolutely normal and will probably be there for another few weeks until birth. So when it comes to the doctor's checkups, what will happen in the next weeks? These could be more regular now, so they might be scheduled for every 2 weeks now, just to check on baby's growth, development, on your blood pressure, on their position. You might also have a blood test to see if you have anemia, and you might need an iron infusion, as well as you might be tested for the Rh factor. And another thing that could happen in the next weeks is you might get the whooping cough vaccine. And this is so that you pass those antibodies onto your baby, because the whooping cough is a very dangerous illness, especially for newborns. So to protect them against that, you can ask your doctor if you're going to be getting that in the next weeks as well. So that's it from me. Week 30, very exciting. Join me for the next week's workout videos. And take good care of yourself, eat well, drink plenty of water, and get as much rest as you can. Thank you for joining today, and I'll see you so soon. Bye.